the Bong
and Sapin.
joint.
So today we will talk and demonstrate the limitations of motions, and we will tackle it with mobility exercises like
So the mobility exercise we're gonna use today, one is dynamic stretching, second is active isolated stretching, and lastly, the most effective one is the proprioceptive neuromuscular facilitation, also known as PNF. So let's get started.
So for today, we're gonna first demonstrate the Thomas test to confirm the presence of a tight hip flexor. So for Thomas test, first you will hold one limb upwards, then you will hug it. Then when you see the posterior thigh elevate from the bed or the plinth, it confirms the presence of a tight hip flexor. So now we're gonna demonstrate. So we have Mr. Sapin here. Say hello.
hello.
So, Mr. Sapin, please lie down. And Mr. Sapin, I want you to please grab your right leg. And right leg, yes. And then hug it, please. As you can see, Mr. Sapin has a presence of a tight hip flexor on the left because of the elevation from the bed. Look up there. So this confirms the presence of a tight hip flexor. We have this hot towel, something to heat up the muscles to promote distensibility, and so we can make it even more stretchable rather, when performing the exercise. So Mr. Sapin, please put this on the front of your thigh. 5 minutes per side, and after that we can start with the exercises. So we shall start with the dynamic exercises and stretching. So we're gonna do this to promote blood flow to the muscle and give more mobility to the muscle. So Mr. Sapin, please demonstrate the hip active dynamic stretching. Yes. So we incorporate both hip flexion and extension to give it more mobility throughout. So 3 sets of 10 per side. So for the first exercise, we'll do a hip lunge in a stretching form. So this is a combination of active isolation stretching and PNF. So Mr. Sapin, please lunge for me. So going down, you will use your glutes on the left side, stretch, and then now you're gonna hold, and now you're gonna contract your quadriceps and other hip flexors to promote the stretching. You're gonna hold it 8 seconds or more, 8 to 10. Then you're gonna do it on the other foot. Another exercise is the pelvic bridging. So first, we're gonna contract the glutes going up to promote the stretch of the hip flexors. Then we're gonna hold it for 8 to 10 seconds. Now while holding it, we want to contract the quadriceps and the hip flexors, and then hold, promote the stretch. We're gonna do that for 8 to 10 second hold with 10 reps and 3 sets. So for the last exercise, we have the so-called Cobra Stretch in yoga. So this will intensively stretch your hip flexors while stabilizing your distal limbs. So Mr. Sapin, please demonstrate. So going there, we want to slowly stretch, use the glutes going down. Now once you're down, contract your quadriceps and other hip flexors. Hold it for 8 seconds and do it for 10 reps, 2 sets. Now that we're done with the exercise, we're gonna do static stretches for both legs. And then we're gonna apply a cold pack to promote tissue repair and keep the body temperature at normal.
Since the action of hip flexors is hip flexion and external rotations, these muscles are stretched by hip extension and internal rotation.
According to a study by Aslan et al., a single session of hold, relax, proprioceptive neuromuscular facilitation or PNF combined with dynamic stretching elicits great and significant improvement towards hip flexion and hip extension, improving the overall range of motion of the hips. So the best way to tackle limited range of motion is really stretching.
When there is a prolonged position, try to move or stretch to prevent muscle shortening. Stretching the muscle will reduce the likelihood for us to get an injury. Always remember, Stretching the muscle will reduce the hustle.